we talk about adherence, we think about adherence in terms of what is best for the patient to have. So for example, a patient should get a flu shot. A patient should fill his or her medication and take the medication appropriately. A patient should get a hemoglobin A1C test. A patient should have a microalbuminuria test. So adherence is both appropriate tests, appropriate lifestyle changes, and appropriate use of medication. And the reason I mention that is it's easier to pay a doctor to get changes made that are made in one episode. So I can pay a doctor to call the patient back to get a hemoglobin A1C. That's something we can do. We can pay a doctor extra if the patient gets the microalbuminuria test. It's a little harder to pay a doctor extra for a hemoglobin A1C below 7 because that changes during the year. It's a little more difficult to pay a doctor for a patient filling a drug prescription. So those are that's how we can decide what we might pay a doctor for as opposed to what we might not. Paying a patient, again, ignoring any regulatory difficulties in doing that, I think first we all agree that removing barriers to treatment works. So if there's a barrier because of a high copay or a high deductible plan, removing that barrier helps improve adherence. Beyond that, paying somebody to take medicine works, but the amount we're paying has to be significant, and it's not clear that there's any sustainable way or that we could pay the kind of money that would need for someone to continue to take a medication for chronic disease. And we also have the problem that we know that when the payment is stopped, either because the program stops or because the member switches insurance companies, those payments stop. And we know that when the payments stop, the change made from the payment doesn't continue. So yes, there are certain instances where we can pay physician. There are instances where we can pay the patient. For instance, if we paid a patient to get a flu shot, we know the incidence of people getting flu shots goes up. And there are certain instances where it doesn't make sense to pay either one.